Debs Clavicillas from BSN 212A Group 2, and today I will perform the female urinary catheterization return demonstration. So urinary catheterization is the insertion of a catheter into a patient's bladder. The catheter is used as a conduit to drain urine from the bladder into an attached bag or container. Catheterization reduces the risk of infection and kidney damage by making sure that the bladder is empty either continuously or regular interval. So prior to the conduction of the procedure, we have to check the doctor's order for catheterization. This is to ensure that we have the right patient and right procedure to be done. Next, I have performed hand washing to deter the spread of the microorganism that causes infection and or disease and contamination. Now I'm going to perform only the hand hygiene. And I have prepared the necessary equipment to save us time and effort. So this includes the two-way Foley catheter and a catheterization set, which includes the urinary bag, 10cc syringe, gauze pod, forceps, and of course we have our draw sheet, our kidney basin, our bandage scissor, bandage, and the light for a better visualization on the private part later on. Now we are going to introduce ourselves to the client and identify the client's identity using two-way identifiers rather. This is to ensure we are doing the right procedure to the right patient. So, good day ma'am, I am Nandi Bebs, your student nurse for today. So, may I see your wristband please? Okay, thank you. Can you state your complete name? And your birthday?
July 16.
Okay, thank you. After that, we are going to explain the procedure to the patient so that the patient will be well aware of the whole procedure and also for them to cooperate well. So today, ma'am, the procedure we will be doing today is the urinary catheterization, and it is on the physician's order. And so what I am going to do, ma'am, is I am going to insert a tube through your urethra and connect it to your bladder so that you can excrete your urine. Okay, so later on the procedure, I am going to expose your genital area, ma'am, and you might feel a little uncomfortable, but you don't have to worry because I am only going to expose area that will be part of the procedure. The rest will remain covered. Okay? If you feel uncomfortable or uneasiness, feel free to tell me. Okay po? Okay. Do you have any questions regarding the procedure before we proceed? Okay, thank you. So before we begin, we need to provide privacy by screening or closing the door and position the patient on the dorsal recumbent with the knees flexed. So I have okay. So, ma'am, can you flex your knees? Okay, so this procedure ensures that the patient is comfortable and has a good visualization in the meatus, which is essential to introduce the catheter. Also, gravity will aid the flow of the urine when the bladder is higher than the end of the catheter. So the next thing that I'm going to do is to drape the patient, exposing only area that will be used. So ma'am, I'm going to expose your private area. This is done to avoid the patient from getting embarrassed and having chills, which causes tension and which may interfere with the easy insertion of the catheter later on. So after that, ma'am, I'm going to place an underpad so that we can protect the bed from becoming soaked, okay? So can you lift your buttocks for me, ma'am? Alright, now that we're done, we're going to provide a direct light for the visualization of the genital area. Okay. Next, I am going to open my tray set and arrange the equipment accordingly. This is for convenience and to maintain the sterility of the equipment. After doing that, I am going to use the sterile forceps to pick up some cotton balls that are soaked in a cleansed solution to clean the genital area of our patient. Thorough cleaning of the meatus and the area surrounding it reduces possible introduction of microorganism in the bladder. So first, let's line down and from here up to here, and then discard. Next, I'm going to use another cotton ball for the labia majora. Remember that we should never replace or trace a stroke to ensure that we do not contaminate the cleansed area. And now let's proceed on the opposite side using a different cotton ball. Now, with another cotton ball, let's do the labia minora. And with another cotton ball, the other side. And then discard. Now we are going to open the set. So inside my set, I have an eye sheet, the sterile glove, the urinary catheter, and a cleansing solution. And I also have a pre-filled syringe, which is 10 cc that we'll be going to use on inflating the balloon of the urinary catheter later on. And I also have the sterile forceps, which I have used on cleaning the private area of our client, and a lubricant. Now I am going to add a catheter on my tray set. After that, I am going to put on the sterile glove. This is to protect ourselves to the client and vice versa. So we're going to glove our dominant hand first. And on the other Okay, so after donning my gloves, I am going to get my eye sheet and place it on my patient.
Ayun na kahit.
Now I am going to lubricate the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. Okay, so the lubricant reduces friction and urine will flow out of the catheter if lumen is not occluded. So pick up the catheter at least 3 inches from the thumb and place the thumb on one finger of the left or right hand between the labia minora and separate and pull up gently. So separating the area surrounding the meatus provides visibility. So now I am inserting the catheter into the meatus for around 2 to 3 inches until urine begins to flow. So it is known that the female urethra is approximately 1.5 to 2.5 inches. Now, if the specimen needs to be collected, pinch the catheter because the urine will flow out if the lumen is not occluded, and place the specimen container in place. Okay. So, now rest the hand on the patient's pubis while holding the catheter in place to avoid pushing and pulling the catheter, because withdrawing and pushing the catheter back in the urethra may cause an infection on the urethra. The next thing that I am going to do is to connect the catheter and the urine bag. Something to put on. So we must make sure that the urine bag is closed to avoid leakage and maintain the sterility of the connection. Next thing to do is to inflate the balloon with 10 to 15 cc of sterile water. So here we have our sterile water. So the balloon will prevent the catheter from slipping out of the patient's body. Also, when the catheter needs to be removed, then the balloon will be deflated. So now I'm going to secure the indwelling catheter by taping the catheter on the patient's thigh. So our female's thigh is known to be the best area to tape the catheter, and for males it is the abdomen. So connect it in your thigh, okay? And of course, we have also to provide some slack to accommodate the patient's movement. After that, we remove this. We must put the urine bag in the side of the patient below the bed. Okay, after that, I will remove this eye sheet and place the patient in a comfortable position. So, ma'am, you can now lay down properly. So now we're going. So we're done, ma'am. How do you feel for? So now I'm going to discard my gloves. After doing this procedure, before that I have to turn off the light. After doing this procedure, performed aftercare to the equipment used. And perform hand hygiene. So now that we're done, we have to document the procedure. For the documentation of the urinary catheterization, always include the date and time of the procedure, the type and size of the catheter used. So I use the two-way Foley catheter latex silicone coated and it's in size 16. Also record the amount of fluid used in the inflate the balloon. So I use 10 cc of sterile water. Okay, so we also have to document the character and amount of urine, the reaction and response of the patient, and include other significant observation. Okay, so I guess that ends my return demonstration of the female urinary catheterization. Thank you and God bless.